Herpes symptoms. Some common questions people ask about herpes. What happens in an HSV infection? What are the symptoms of genital herpes? Can symptoms be treated? Can symptoms come back? What causes symptoms to come back? Can symptoms be treated at home? How serious of a health problem are the symptoms of genital herpes? Today we are here with the answers. What happens in an HSV infection? Genital herpes virus is passed from one person to another through sexual contact. This happens even if the person with the virus doesn't have symptoms or signs of infection. Once the virus enters through the skin, it travels along nerve paths. It may become dormant, inactive, in the nerves, and remain there indefinitely. From time to time, the virus may become active. When that happens, the virus travels back along the nerve path to the surface of the skin, where additional virus is shed. At this point, the virus may cause an outbreak of symptoms, or it may remain undetected. In either case, the active virus is easily passed from one partner to another through sexual contact. Even wearing a condom may not protect the uninfected partner. The virus can be present on skin that remains uncovered. The number of recurrences or outbreaks a person can have may vary. Of the following symptoms of a genital HSV infection can occur in a man or a woman: cracked, raw or red areas around your genitals without pain, itching, or tingling. Pain from urine passing over the sores. This is especially a problem in women. Headaches, backaches, flu-like symptoms, including fever, swollen lymph nodes, and fatigue. Can symptoms be treated? There is no cure for genital herpes, but the symptoms can be lessened and prevented with treatment. Treatment can also reduce the risk of infecting others. Your healthcare provider may prescribe antiviral medications to help prevent or reduce the pain and discomfort from an outbreak of symptoms. Medication taken on a daily basis to suppress the virus can reduce the risk of infecting others. Can symptoms come back? People who have an initial outbreak following a genital HSV infection can expect to have 4 to 5 outbreaks within a year. As time goes on, your body builds up more immunity to the virus, and the outbreaks may become less frequent, even stopping altogether in some people. What causes symptoms to come back? When symptoms recur, they usually come on during times of emotional stress or illness. That's because, during these times, your body's immune system may be less able to suppress the virus and keep it from becoming active. Symptom triggers can include fatigue, illness, sexual intercourse, menstruation, stress, surgery, trauma. Can symptoms be treated at home? There are things you can do to relieve the discomfort and severity of symptoms during an outbreak. Home treatments include: take painkillers such as aspirin, acetaminophen, or ibuprofen. Bathe sore areas with a warm salt water solution twice a day, 1/2 teaspoons salt with 1/2 pint warm water. Let air circulate around the sores by wearing loose-fitting clothes. Put an ice pack on the affected area. Wrap the ice pack in a towel or piece of cloth. Get plenty of rest. There are also things you can do to avoid passing the virus to other parts of your body, as well as to other people. Take these steps. Don't kiss when you or your partner has cold sores. Avoid oral sex when either partner has oral or genital sores. Don't have genital or anal contact when any sores are present. Wash your hands with soap and water after touching infected areas. Don't wet your contact lenses with saliva. How serious of a health problem are the symptoms of genital herpes? For most people, genital herpes is not a serious threat to their health. Aside from the discomfort, an HSV infection is more of a psychological stressor. It can create anxiety, affect a person's self-esteem, and interfere with a person's sense of security and intimacy. In some cases, though, complications from genital herpes can be serious, even life-threatening. For more information on herpes, just click on the link given below this video in the description.